Hello, everyone. Well, we are talking about arthritis. As all of us age, most of us are probably going to develop arthritis, and we don't want that to happen. So, how can naturopathy help? That's the topic for today's discussion with Dr. Pistoia. Dr. Pistoia is a naturopathic doctor joining me live from Connecticut. Welcome.
Thanks for having me. Happy to be here and talk about arthritis today and how we can help people.
Thank you. So let's just understand, how does arthritis develop? What is the root cause? And especially if it is related with the age.
Yeah, so typically, there are multiple types of arthritis, and arthritis associated with aging is typically what's called an osteoarthritis, which basically just means it's an arthritis that involves a certain number of joints and is related to what is thought to be joint degeneration. So you'll often hear about joint wear and tear and sort of joints wearing out over time, because at every joint there's things like collagen and these fibers that sort of make up the lubrication and the fabric of those joints. And what is believed to happen is, over time, as you get older, you're using your joints for all these years, right? And then so they start to wear down. Now, that's one sort of theory about what happens. But then you think about, well, some people have joint problems when they age, but other people don't. So the whole wear and tear thing doesn't exactly make a ton of sense if you think about it logically, because it doesn't affect everyone. And also because people who are more active, typically in a balanced way, let's not say overactive, but people who are active and they sort of exercising and they go for walks and they're, ride a bike and they do this multiple times a week, these people are usually less likely to develop osteoarthritis. So the point that I'm making is that even though they're more active, the whole wear and tear thing doesn't necessarily make sense versus people who are really not active. Typically, people who are underactive are the ones who are developing joint problems. And that's because the simple adage in the body is, if you don't use it, you lose it. So when it comes to things like muscles, we know that if we've ever worked out before and we've gained muscle, it was because we were giving our body the stimulus to build more muscle. We had to lift weights or anything really. If you're running, you're going to be able to take and utilize oxygen better because you're putting a demand on those body systems. So the same exact thing applies for the joints. If you're using your joints, if you're putting stress and weight on your joints, then your joints are going to protect themselves. They're going to strengthen themselves, and that's what's going to keep them from wearing down. So you see how it's sort of the opposite of the wear and tear thing, where we think we're doing too much and that wears us down. Actually, for a lot of people, doing stuff more often, more activity on a regular basis is what builds the joint up. So that's a very fundamental way of looking at why the joint may wear down and how we can do some things to protect that and prevent that from happening. So that's sort of a good starting place for it. Just to briefly add, the problem with, what does arthritis mean, right? It actually just means inflammation of a joint. So, the cause of pain and some of the symptoms like stiffness and swelling is the inflammation. So basically the joint has an inflammatory process, which involves the immune system, and the immune system is sort of trying to clean up that joint, trying to protect that joint. And again, the reason for a very fundamental perspective is because the joint needs to be sort of worked. And we can think of that as, whether it's an inflammatory response or from exercise, it needs to be worked. It needs to be some stress placed on it. So I hope that's a good intro to arthritis and it's not too confusing.
No, I think that's great. So now we understand, the symptoms and the cause. So let's just dive right into how naturopathy can help. And this is not a medical advice, by the way. This is just overall understanding of protocols as to what are the different, tools that you're using, right, to help your patients who have arthritis.
Right. So I'll start with, well, as I may have already revealed, exercise on a regular basis is very, very helpful for arthritis. It gives your joints the stimulus it needs to have to build up some of the protective mechanisms that are going to keep the joint sound and stable. So, if you want to repair something in the body, you have to give it a stimulus. So, it's the same thing. Let's use the muscle example again. If you want to build stronger muscles, you have to lift weights, right? You can't just sit around. Your body's not going to build it. If you want to build up a healthier joint, you've got to put stress on the joint. So the body says, okay, we're having some stress in this area. We need to reinforce that area with the collagen, with the tissues that it needs to make the joint stable. So exercise on a regular basis to a point where it's not going to be too difficult, where you're really struggling and your joint is killing you and it's hurting. You want to be just enough of a stimulus to where the exercise is challenging, but it's not overwhelming. And you gradually increase in the intensity and the frequency of things. And of course, you talk to your practitioner about what are your limits, about how often you should be exercising. And if you're going to start a new exercise program, you always want to get with your primary physician to understand, okay, is this something that's safe for me to begin, and where should I begin if that's the case? And I think for a lot of people, it is safe. I mean, it's very natural for us to exercise. Hundreds of years ago, thousands of years ago, we were constantly walking around and, moving around a lot. And unfortunately, because of the way the society is, we're now sitting a lot more often. So we're not placing as much stress on the joints. And so things just start to get a little bit more sticky when that happens. So exercise, very foundational, fundamental thing that we can all do a little more of, that really helps with arthritis. So don't underestimate the basics. Another thing is water. Just in general, people aren't drinking enough water. And water helps to lubricate our joints. It helps to lubricate everything in the body. Sometimes when you're real thirsty or in the morning, you take a drink of water, you can feel it going all the way down through your intestines and just sort of bathing your cells. And so the body likes to be moist. It likes to be hydrated, and especially our joints. We actually have fluid in the joints that sort of just surrounds the joint and encapsulates the tissue and makes it work better. So if we're not drinking enough water, it can definitely lead to problems. And some people will even notice they drink within a few days, they drink more water and say, yeah, I'm starting to feel better. And it's a really easy thing that you can do. So those two fundamentals, I would say, are extremely important. If you master the fundamentals, you have a really good starting place, not just for arthritis, but also for any other disease. So now let's talk about how to control the inflammation, right? Because the joint is inflamed. And typically when that happens, you'll have the pain, you'll have the stiffness, and you also may have swelling in certain circumstances. It could also be red as well. These are all cardinal signs of inflammation. So, very simply, when we're trying to control a symptom, we always think of doing the opposite of the symptom. So if we have inflammation, we want to give an anti-inflammatory. And so one of the best ways of controlling joint inflammation that I know of as a naturopath is to use boswellia. And boswellia is also known as frankincense. It's been a well-regarded medicine for thousands of years. They talk about it in the Bible. Frankincense was one of the gifts that was given to, I think, was the baby Jesus. Not 100% clear on the story, but it was a very well-regarded medicine. It still is today. We just call it boswellia instead of frankincense. They also have frankincense essential oil. They use that name for that. But anyway, boswellia is a very potent anti-inflammatory, and it's well studied. There's a good amount of evidence on boswellia. I actually came across some excellent studies recently. There's a particular kind of boswellia that they use to control inflammation. It's a form called 5-LOX, 5-LOX. And it's basically just a very potent form of boswellia. It's standardized to contain a certain number of compounds that have been studied to control the inflammation. So not all products or herbs are created equally, especially when they're packaged and capsulized. So it has a really remarkable anti-inflammatory effect. Patients have told me that it really works for them. And it's often combined with things like turmeric, which a lot of people have probably heard of. Turmeric is great because it's not only anti-inflammatory, but it also helps to digest. So it's stimulating for the liver. It has the liver release more, and the liver and our digestive organs release more digestive enzymes and things that help break food down. So an example is it helps to release more bile in the gallbladder, and that helps us to digest more fat. And so this concept of digestion and it improving digestion also implies to sort of cleaning up the area around the joints. So sometimes if when there's damage and inflammation to the joints, the immune system moves in to try and clean it up and repair the area. So turmeric sort of aids the body in that cleanup effect, that digestive effect, not only in the gut, but also in the joints. So it has a really remarkable effect on the whole body, and not just one area, but especially for the joints. So boswellia and turmeric are really good starting places herb-wise that people have told me. I don't have arthritis myself, but people have told me that those two things work really well. Now, let me throw in one more thing for you because it's all the rage right now, and that's CBD. So cannabidiols from the marijuana plant are really popular right now, and they're also experiencing a greater rapidity of research. So we're seeing a lot more research around it, which is great. So we want to understand how it's working. And so CBD is basically been shown to modulate pain in the body. And so, one of the main problems that people present with arthritis for is pain. So if we can help the pain, we can help people feel better. And so CBD sort of controls the pain receptors. So it makes us the pain, it decreases the amount of pain that we're experiencing. And one of the best ways to get that effect is to use a CBD cream. And you just sort of rub it right on the joint, and it works pretty quickly. I've used it myself just for, from exercise, doing too much exercise, feeling a little pain in my joints, and it works really well. So CBD, cream, boswellia, and turmeric, I would say, are great starting places when it comes to natural medicines.
I think that's a great list. The only other question I would ask you before we wrap up is that, like detoxification, you talk about the inflammation of the joints, right? So is there
Mm-hmm.
any detoxification therapies that you use as a naturopath to help get the inflammation out?
Absolutely. I love the topic of detoxification, and I want to clarify a few things. So we're always detoxifying. We hear a lot about detox diets and detox as a concept, like something that we need to do. The body is always detoxifying itself. It's fundamental to life. The kidneys, the liver, the GI system, the skin, all of these organs are working constantly to get toxins out of the body. And toxins come from all different places, not only foods and contaminated products or packaged products too, which have preservatives and things that really don't agree with us. They're really not from nature. They're not found in nature. Those sorts of things that we get exposed to make our organs work in overtime to get rid of them. So we're always detoxifying. Now, I know your question is more specifically, well, how can we help detoxification work a little bit better? So now that we have the basics of detox, the first thing is water. So I'm going to throw that in there again because it cleans everything out. It's what the kidneys need to extract things and push things along. Same thing with the GI system. But what I like to use more specifically for helping the organs work better, the organs of detoxification work better, is something called undas, UNDA. And undas are these what are called numbered compounds, and they contain low dose botanicals. So they're actually in a homeopathic preparation. And anytime you see an X next to a number, like 1X, 2X, 3X, 4X, which you'll see on, for example, the Zicam box. If you've ever used Zicam, it's a pretty popular cold remedy. And most people don't know they're actually using a homeopathic product. And you'll see zinc in, I think, 2X or 3X. So that's a homeopathic preparation. Now, undas are combinations of botanicals in homeopathic preparation. So I could say some of the names of the herbs, but they're all in Latin and people probably won't know what they are. But the numbered compounds are all oriented towards specific organs, systems. So for example, one of the things I give very often is a combination of 3 Unda numbers. And it works to support general detoxification, especially of the GI system, which is taking a lot of the brunt of our toxic load right now, but especially the liver. The liver is the gatekeeper to the rest of the body, and it's where all the waste sort of gets filtered in when you eat something. When you drink something, when you take anything in, everything has to go to the liver first. And the liver sort of filters and stores things. And then it goes eventually to the kidney as well. So supporting those two organs with the use of low dose botanicals is my go-to strategy for getting rid of the toxins. I hope that makes sense.
No, I think that makes perfect sense. I mean, this is a quick 10-minute wellness tips that we bring on a daily basis, not a medical advice, just to help you that you can prevent arthritis by using naturopathic medicine and naturopathic therapies that we just shared with you. Anything else you'd like to add before I wrap up today?
I'd like to add is that, if you're suffering from a problem or a symptom or a disease, just always keep in mind that there's things that you can do to help your body work better, to help you feel better. You don't have to be stuck with the disease for the rest of your life, and you don't have to be reliant on pharmaceuticals, even though they're helpful in many situations. There's a lot of options out there, and a lot of times simple changes repeated over time can really make a big difference in terms of your quality of life.
Thank you. And that's exactly what we are propagating, advocating every single day. We are not discarding pharmaceuticals here, but we are
Mhm.
saying that naturopathy, see, that should be your first line of defense, and on
Absolutely.
a regular basis, right?
Hmm. Yep.
And that's what the doctor is ordering. So
Right.
stay tuned, everyone. Thank you so much. Happy holidays. And stay tuned as we are launching a lot of free videos. We're going to make them available, as well as the workshops that we will be launching super affordable. So stay tuned, and thank you, everyone, for your support on a daily basis. Thank you. Bye-bye.